All right, let's get right into it. If you're involved in developing AI for medicine, and especially for cardiovascular care, I need your full attention. The rule book has just been torn up and rewritten. Seriously, the whole era of just showing potential, that's over. We have officially, and I mean officially, moved from what if to show me the proof. So today, we're going to break down the new AI playbook, and it's coming straight from one of the most influential cardiology journals on the planet. You know, for the last few years, it's felt like a total AI gold rush, right? A flood of new models, super exciting algorithms, a ton of research papers being submitted. But that initial kind of Wild West phase of excitement, well, it's coming to a very abrupt end. A new era of accountability, of really intense scrutiny is here. And believe me, it is changing the entire landscape.
And really, it all boils down to this one simple question. This is what's driving the entire shift. It's just not enough anymore for an AI model to be technically clever or impressive on paper. The real gatekeepers of clinical practice, we're talking about journals like the Journal of the American College of Cardiology, or JACC as everyone calls it, they're asking a much more basic and frankly much more important question. Does this thing actually help patients?
And that question right there is forcing what we can only call AI's clinical reality check. JACC is going right after a huge problem that everyone knows exists but hasn't really tackled head-on. This massive gap between a brilliant AI model that works perfectly in a lab and what's actually practical in a chaotic, busy clinic. I mean, that gap, that's the chasm where so many promising technologies just go to die.
And look, if you need proof, this quote from their new editorial says it all. This is not a gentle suggestion. This is a declaration, a line in the sand. They're basically saying that papers that just look back at old data and show a cool performance score, well, that's not going to cut it anymore. What was good enough to get published yesterday is flat out not being accepted tomorrow. The bar has been raised, and it's been raised high. Now, here's where it gets really interesting for anyone on the business side. This isn't just some academic debate. This shift in a journal's policy creates a massive business risk. For any life sciences company pouring money into AI, this is a flashing red light. Think about it. Spending millions on R&D for a model that can't clear this new bar means you're building something that might never get published, never get validated, and never get used. All of a sudden, that project isn't just wasted R&D, it's a stranded asset. And that's the kind of thing that makes investors very, very nervous. Okay, so if that's the risk, what's the solution? What are the new rules of engagement? Well, the good news is JACC didn't just raise the bar and walk away. They actually gave us a playbook. And honestly, it's now essential reading for any team that wants to build AI tools that are not just successful, but actually make a real impact in cardiology. And this whole playbook really comes down to three things. Think of them as non-negotiables. First up, clinical relevance. I mean, does it solve a real problem a doctor is facing today? Is it a nice to have or a need to have? Second, your evaluations have to be fit for purpose. This just means the evidence you provide has to match how far along your tool is. You can't use early-stage proof for a late-stage claim. And finally, everything, and I mean everything, has to be built on a foundation of transparency and reproducibility. Can other people trust your work? Can they build on it? If not, it's a non-starter. You know, that second principle, the fit-for-purpose evaluations, it's so important we need to spend a little more time on it. This is where we have to look beyond just the raw performance of the algorithm. The whole definition of what a good AI model even is has completely changed. It's not about chasing one single number or one accuracy score anymore. So check this out. This is the shift in a nutshell. The old way was being obsessed with a metric called AUROC. The new mandate is a much more holistic, real-world evaluation. Let me give you an analogy. A high AUROC is kind of like saying a detective is really good at telling the difference between a picture of a criminal and a picture of an innocent person. Okay, that's nice. But a metric like positive predictive value, or PPV, that tells you, of all the people this detective actually puts in handcuffs, how many of them are really guilty. Now, if you're running a busy clinic and you're trying to avoid a ton of false alarms, which number do you think matters more? It's the second one. Every single time. And this new focus on real-world utility is perfectly wrapped up in what JACC is now calling the 4 stages of impact. Basically, they've laid out a new framework for AI research. And for anyone in life sciences, it's going to feel incredibly familiar. Why? Because it looks a whole lot like the phases of drug development. It's finally bringing some much-needed structure to the sometimes chaotic world of AI development. So let's walk through this continuum. Stage 1, that's the classic stuff.
Initial development, validation in the lab. It's important, but it's table stakes. The real game changer is what comes next. Stages 2, 3, and 4. Stage 2 is all about, can we actually implement this in a real-world workflow? Stage 3 is, okay, now that it's out there, is it having a real impact on patient care? And stage 4, which is so often ignored, is about long-term monitoring and updates. This whole framework, it's the clearest signal you could possibly ask for about where their priorities now lie.
And here's the bottom line. JACC is now explicitly prioritizing papers that show work being done in stages 2 through 4. The entire focus is shifting away from the theoretical question of, can this algorithm work in a perfect world, and moving squarely to the much harder and frankly much more important question, does this thing actually work in the messy, complicated reality of a hospital? So, what does all this mean for you and your team? Let's make the pivot to what's probably the most important part of this whole briefing, your strategic action plan. We're going to take this new academic playbook and translate it into a concrete, actionable business strategy. First things first, R&D strategy needs a serious recalibration right now. It's time to take a hard look at your portfolio. How many of your projects are stuck in stage 1? You've got to shift that focus. Prioritize the AI tools that solve a real, nagging clinical need, not just a cool technical problem. This means thinking about workflow from day 1, not tacking it on at the end. And maybe most importantly, you have to mandate that every single project has a plan for prospective, forward-looking evaluation. Why? Because that's the only kind of evidence that's going to impress regulators and convince payers to write a check. Next, you need to use this shift to build a serious competitive edge. See, this isn't just about checking a box or complying with new rules. It's a huge opportunity to stand out. Be the company that leans into transparency, that makes its code public to build trust with the top doctors. Make clinical utility, not algorithmic accuracy, the absolute core of your value proposition. You have to tell a much more compelling story of impact, one that goes way beyond a simple performance metric, because that's the story that clinicians will actually remember, and more importantly, that they will champion. And finally, you have to future-proof your AI assets. An AI model isn't a product you just ship and then forget about. Its performance can and will drift over time in the real world. That means you need a rock-solid plan for monitoring it after it's deployed. This is about protecting against liability and ensuring patient safety. You have to design for recalibration right from the very beginning. And, this is a big one, you even need a plan for when it's time to turn a model off. This isn't just good practice anymore. It is absolutely essential for long-term commercial success and for de-risking the entire investment. So let's just end with this one question. The standards have officially changed. The message from the clinical world could not be any clearer. So it's time to go back and look at your strategy, look at your R&D pipeline, and ask yourselves a very honest question. Is your AI portfolio built for the clean, perfect conditions of a lab, or is it built for the messy, demanding, and unpredictable real world?